Imagine your intestine absorbs fat, but has no trucks to transport it. What happens? That's the basic idea behind Abetalipoproteinemia. The defect is microsomal triglyceride transfer protein, MTP. Without MTP, ApoB containing lipoproteins cannot be properly assembled. Therefore, chylomicrons, VLDL and LDL are markedly reduced or absent. HDL is relatively preserved. Without chylomicrons, dietary fat and fat-soluble vitamins are poorly transported, causing fat malabsorption, steatorrhea and deficiency of vitamins A, D, E and K. The most important exam clue is vitamin A deficiency, causing ataxia, peripheral neuropathy and retinitis pigmentosa like retinal degeneration. Another classic finding is acanthocytosis, spur-shaped red blood cells. NEET PG log, MTP deficiency means no ApoB containing lipoproteins, fat malabsorption, vitamin A deficiency and acanthocytosis.